The 8th annual M.O.S.T Mariachi Festival starts June 1st, which benefits the Mercy Outreach Surgical Team, or M.O.S.T. So here to tell us about it are volunteers, registered nurse Susana Verdugo Ramos and Dr. Kent Dively. Good morning to the both of you.
Good morning.
Good morning.
This program, M.O.S.T, has been going on for 32 years, which is fantastic. So it involves traveling to Mexico and providing some of those critical surgeries to people who really wouldn't normally get those services. Susana, could you tell us a little bit about why this was all started?
Well, it was started back in 32 years ago, and initially was a group of nurses that in Mercy Nurses Hospital that wanted to give something back and wanted to help. And so initially they were bringing buses over to Mercy Hospital and performing surgery. And that changed back in
Well, we quit doing that when in 2011 because it was impossible to bring patients across the border after that.
Right.
But we'd always gone and done at least two-week trips a year to different places, locations in Mexico.
Yeah, and so we're talking about surgeries, everything from correcting cleft palates, removing extra fingers or toes, correcting vision, cross-eyed, hernia repairs. And these are surgeries that can really make a difference in a young child's life. Dr. Dively, can you tell us some of the changes you see? Because really, sometimes these kids are just pushed out. They're ostracized from the community.
It's very difficult. It's difficult to be a kid going to school anyway. And if you have a physical deformity, it's particularly hard to go to school. And so correcting a cleft lip, correcting a cross-eyed kid makes a huge difference in their lives and the lives of their families. We go down there, Dr. Harry O'Halloran, who we're honoring at the Mariachi Festival this year. We recently made a trip to Mexico, did over 100 surgeries over a period of 2 or 3 days. And these are cross-eyed kids. One of my favorite kids, I remember down in Mexico, a little boy comes in, he has nystagmus, which is a problem when your eyes are jerking back and forth all the time and you can't see very well at all. So Harry makes the correction, and the kid is being wheeled out of the hospital saying, "I've been saved, I can see." Aww. And it was heartwarming to see that, and also was good for business. So it was great to see that little boy.
Wow. I mean, the number of surgeries to do in such a short period of time, that's exhausting, but to see that finish is so worth it.
I think the organization was started to give people the opportunity to use their skills in a voluntary and pro bono manner, and the rewards from that are heartwarming. And I've gotten a lot more from participating in M.O.S.T than I've really ever given, and it'll be my 50th trip this October.
Oh, good for you. So you mentioned, I mean, this is pro bono, but it's still, even though the volunteers, the nurses and doctors are providing their services and their knowledge for free, it costs a lot of money to do this. And so that is where we get to the fundraising aspect of this. So June 1st, I mentioned, is a big mariachi festival. Tell us how that works, what people can expect if they go.
They can expect a lot of fun. There's delicious food. There's a lot of raffles, not raffles necessarily, but a lot of silent actions, live actions, and it's fantastic. It's a lot of camaraderie, and it's a great opportunity to give a little bit and experience what it's all about, what M.O.S.T is all about.
Yeah. Go ahead, Dr.
I was going to say it's gone from a very small event, and now we're having it's a very nice event at Humphreys by the Bay, and so there'll be tables. It's a beautiful venue. There's still tickets left. We have probably less than 100 tickets left, but if people want to go, it's an easy way to help the organization raise money, and
you get to hear a Grammy award-winning mariachi band, Los Camperos. So it's a fantastic evening. And to date, M.O.S.T has helped 14,000 children. So just want to make sure that everybody understands this is going to such a great cause, and we're so appreciative of the work that you're doing and thankful that you're able to do it.
Thank you.
Thanks for having us here.